Good evening. I'm Mayor Ron NIRENBERG with Bexar County Judge Nelson Wolff. Tonight we're joined by Sheriff JAVIER Salazar along with RITA ESPINOZA, our Chief of Epidemiology for San Antonio Metro Health, and this is our COVID-19 update for the San Antonio community. We're reporting 162 new cases of COVID-19, which brings our total since the pandemic began to 50,587. Our new 7-day moving average is up slightly to 134 new cases per day, but still is within range of what we've been seeing over the last few weeks. We have one new death to report, unfortunately, bringing the total to 1,025. He was in his 50s and passed away at home. Our thoughts our thoughts are with his family and friends as they grieve during this time. Again, we've lost far too many of our loved ones and neighbors during this pandemic, so we're asking you to do everything you can to keep each other safe. Tonight in our hospitals, there are 218 COVID patients in the hospital, which is up 4 from yesterday. There's also 34 new COVID-19 related admissions to the hospitals, down 3 from yesterday. Happy to report that for the first time in 3 months, exactly 3 months, we are under 100 patients for the first time in the ICU. We have 99 patients in the ICU. Again, the first time since June 17th that we've seen that. There are 43 patients on ventilators, 68% of ventilators available, and 13% of staffed hospital beds are available. I do want to take a moment to remind you of how important it is to answer your phone if you get a call from one of our contact tracers. Otherwise, how would you know if you had been exposed to someone who tested positive for COVID-19 if you don't get that call? That phone call could be what stops you from unknowingly spreading the disease to people close to you, your friends, your family, coworkers, etc. If you get a call from a contact tracer, it means someone cared enough to make sure you were notified that they were sick and might have passed it on to you. This is an infographic on the screen of the city's social media pages right now. Please share it with your friends and family. This will give you, again, a heads up that contact tracers are calling to make sure that you help contain the spread of this disease in our community. Let me turn it over to Judge Wolff.
Yeah, thanks, Mayor. And that 134 on that rolling 7-day average of those that are tested positive it may help to remember how bad things were and could get that way again if we don't watch what we're doing. When the governor took away our mandatory face mask on May the 5th, it creeped up and we were hitting in 1,000 or so a day. I think on a couple of days it's over 2,000. We also ended up with 1,267 people in the hospital, and that number's down to 200 and something. So an incredible effort has been made over the last 2 or 3 months, and it's because the citizens really began to pay attention and we got our authority back to keep the face mask going. So please continue to do what we've preached over and over, which is a social distance and wearing the face mask and sanitation. Let me thank Barbara Harris. She made this scarf for me as well as a face mask. She's a talented lady, designs unique quilts and other items for you, so I want to thank her very much for this. I'm going to give the rest of my time to Sheriff Salazar, who's done a wonderful job with the jail. Incredible strides that he's made over the last 2 or 3 months. Sheriff, you want to?
Thank you, Judge. Yeah, thank you all for having me on, Mayor. Thank you all for having me on today. Yeah, we're ecstatic with the results that we've seen at the jail. We're down to actually, believe it or not, 9 inmates that are positive right now. I will remind you that right now we've got we're just under 4,000 inmates. At our peak, because of our very strong forward-leaning stance on COVID, we got in front of it early, and we started our mass testing. So to date, we've tested about almost 8,000 inmates since the onset of this, and so we hit our peak in mid-May. And it's been coming down. We've had some ups and downs since then, but we've got 9 inmates. Today we finally hit single digits. And with regard to our deputies, we've got 10 COVID positive deputies right now. 9 of those work in the jail, and 1 works on the law enforcement side of the house. But that's a number that we're also seeing coming down. And so we're prepared for a bump with the Labor Day. We'll see what happens with it. A lot of our inmates that have come in positive as of the last couple of weeks, months, have been coming in from outside already infected. They're not really catching it inside. Inside the jail, we're still maintaining distancing. which does take its toll on our overtime costs, but still I think it's worth it. But additionally, we're still cleaning the common areas of the jail 3 times with a peroxide-based chemical that's a concentrate. We're still doing 100% mask exchange, and our deputies are still mandated to wear their masks either on patrol or in the jail. When they're dealing with someone face to face, they're mandated to continue to wear PPE until further notice. Talking about our jail population, it is on the way down. The state of Texas has finally started picking up some of their inmates. We've got 115, I think, slated to go this month or this week, and we'll actually be taking some to them. We've started actually delivering to them. And so we're just happy as can be, but we're prepared for anything else that might come along.
Great.
Great. Thank you very much, Sheriff and Judge. Don't forget, you can get the latest on COVID-19 by visiting the website covid19.sanantonio.gov, where you can also find assistance programs as well as other relief that you might need during this pandemic. You can also text COSAGov to 55000 anytime for the latest on COVID-19 in our community. Rita, myself, the judge, and the sheriff are available for questions.
We have a text question from J.J. Velasquez at the Rivard Report. What is the response rate of people who were called by the city's contact tracers, and has that changed since the calls began being identified as coming from the city of San Antonio?
So previously, you want me to take it? Sorry. Previously, we were actually contracting with EMOCA. We had a different company, and they were seeing anywhere between 40 to 50% of individuals actually they're making successful contact. Now we have gone to the state, and they're using the state's contract for making those notifications, and it has changed week from week. So I don't have the whole overall time period, but we've seen anywhere from about 30 to 50% of those individuals being reached. And some individuals not being reached, either they don't return, majority of them not returning phone calls. So as the mayor said earlier, we're really encouraging individuals that as they are receiving these calls, they listen to their messages and they call back the numbers that are being left. It's difficult to say because you're not going to get called just from one number to say it's San Antonio calling or it's UT Health calling. It is a contractor that is calling, so just making sure that they're getting that information, listening to the message, and calling back to get the information, the public health recommendations.
We also have some text questions from the San Antonio Report regarding tomorrow's UTSA football game at the Alamo Dome. How long has the city known about UTSA's plans, and could the city have done anything to stop or forbid the game?
Well, we've known about their plans for quite some time, and if we felt it was unsafe, according to our public health team, we could stop them tomorrow if needed. But we have been working with them in the event it was safe to do, to establish proper safety protocols for entering the building, for seating in the building, for potential service of food in the building. Everything is going to be, almost everything is going to be touchless tomorrow. The distancing measures that are taking place in the seating arrangements are limiting the capacity of the building to 17%. So this will be a test for sure that we can ensure safe events in the Alamo Dome that meet the standards of our public health team. And we'll be watching closely. There will be enforcement in the building tomorrow, and people will be removed from the building if they don't comply with the orders such as masking.
Do you have any details on how that will be enforced?
Well, it's a city facility, so we will have city officials there, part of our city staff, to enforce the orders.
We have a text question from Peggy O'Hare at the Express News. Can we get an update on the number of people who have recovered from COVID here?
Again, those recovered numbers are updated weekly, so I can give you the estimate.
Last one on this report is 40,896. I don't know whether this is accurate on this.
Yeah, I think, yeah, that's a number as of the,
Are those that are recovered in the hospitals?
yeah, that's an estimated recovery based on the CDC protocol for estimating total recovered cases based on the caseload.
We do actually have that in our EPI weekly report as well. I don't have it in front of me right now, but it's a number that we can get to you. I don't recall what it was, but it's put out usually on a Monday once a month. That information is being put out on all of the cases in the city using the estimation from CDC, but we can get that information.
Sheriff Salazar, following the incident involving Damon Daniels, you said that body cam footage would be released, and now you have said that that's not going to happen. Can you explain why that is?
No, I've said all along, body camera footage will be released when I can do so without damaging the case. And so that time has not come yet. When it does, we'll get it out there.
What needs to happen in order for that to take place? Does this need to go to trial, or?
No, not nowhere near that long, but certainly we need to, at the very least, complete the investigation. I mean, the investigation is very detailed. Obviously, it's a very detailed investigation, and so we at least want to complete the investigation. Right now, our homicide unit is still actively working it. I can tell you that out of 24 hours in the day, they're probably working it at least 20 hours out of the day, every day. And then our internal affairs unit is probably half a step behind them, and that's intentionally by design, because anything that might be missed, any witnesses that maybe homicide can't get in touch with, maybe internal affairs will pick up. And so we're working those two all the way through, and I wouldn't be able to give you, a prognosis on when it will be done, but I will tell you that by the time we finish it, it'll be thorough.
One of the deputies that responded, John Rodriguez, he was one of those involved. He was arrested for family violence in 2013 and brought back from leave when the case got dismissed. Should he have been responding to that case?
Well, I can't tell you what happened in 2013. I wasn't the sheriff then. What I can tell you is that the way we treat arrests by deputies, whether they're convicted or not, the way we treat them now is vastly different than the way they were treated under different administrations. So I can't really tell you why he was brought back. All I can tell you is that he was no billed by the grand jury at that time, is what I'm able to read. But as far as that goes, I couldn't tell you.
Thank you.